And we welcome you back to America's Forum right here on Newsmax TV. We got three of us up here on the anchor desk: John Bachman, Morgan Thompson, Newsmax Deputy Health Editor Nick Tate, also best-selling author of the Obamacare Survival Guide. We were talking about calorie counts before.
Yes.
Now we're talking about counting the bottom line, especially for a lot of seniors out there. Millions of seniors will have to dig deeper to pay for their Medicare benefits next year. Nick, tell us, what is behind this cut? Was this what we heard about on the campaign trail? That $750 million cut?
$716 billion.
Billion, I'm sorry,
That's
B.
right, with a B.
B.
Big difference.
Yes, what's behind the rising cost for Medicare? I mean, for a long time, Medicare has been a kind of safe haven for seniors that has kept them from having to face the larger increases in healthcare costs and premiums that we've seen in the general marketplace. That's starting to change as more seniors are picking these private Medicare Part D insurance plans, Medicare Advantage plans, which are private alternatives to traditional Medicare. According to a new analysis by Avalere Health, which is a company that tracks healthcare costs across the country, 6 of 10 of the largest drug plans, Part D Medicare plans, are going to see premiums increase next year by as much as 52%. Only 3 of them are seeing premiums lower, so the message is, for seniors, you really need to be careful about the plans that you're picking. And what's driving it, of course, is the Affordable Care Act, the regulations, the new taxes on insurance companies, and driving up healthcare costs overall. Nothing in the law prevents insurers from passing on those costs to consumers, seniors on Medicare, in terms of higher premiums.
So Nick, over 10,000 Americans are going to be turning 65 each year. Can Medicare survive this, or is it just going to keep getting more and more expensive?
That's really the big picture here. These new hikes are just, I think, a glimpse of things to come. Over the next 20 years, every day 10,000 Americans will turn 65 and qualify for Medicare. Right now, the Obamacare law calls for cuts, and as John suggested, $716 billion over the next decade. So as we see the rising number of seniors turning 65 and qualifying for Medicare, we're also seeing a lowering in the spending. There's already a significant gap between what it costs doctors to provide services for seniors. It's gone up about 20% in the last decade. And what the federal government is reimbursing for costs of that care, it's only gone up about 4% in that time. That's a huge gap, and I think the net result is not only is it going to cost seniors more money, there are questions about the solvency of the program, and finally, whether seniors are going to be able to actually keep their doctors and find a doctor without a long wait list.
Well, Nick, there's a lot of discussion about, over-medicating and doing too many procedures to a lot of senior citizens because a lot of doctors knew that they were going to get paid back by Medicare. Is this an attempt by Obamacare in the federal government to starve those, starve at those doctors? So, to use an analogy here, so if the money's not there, maybe they won't do too many of these procedures that some folks might say might not be necessary.
I think that argument can be made. And in fact, the idea is that there's overutilization of healthcare in this country. People use too much of it. We spend twice as much per capita as virtually every other country on the planet. So this might be a way to drive those costs down. But sadly, the folks that this will hurt are the folks who really need the care. People over 65 generally require twice as much health care as people under 65, regardless of whether they're healthy or not. As you get older, diabetes, heart disease, cancer, diseases of age are far more common, Alzheimer's, and so my concern is that folks are going to get caught in that gap. Now, there are some things people can do, and again, this speaks to the idea of being a savvy consumer, whatever age you are. There are a handful of things you can do. Ask your doctor for free samples. A typical doctor gets about $21,000 a year in free drug samples. He or she will be happy to give them to you if you ask. Think about pill splitting. Order your prescriptions at a higher rate, higher milligram dose, double the milligram dose than you take, and cut them in half. In many pills you can do that. You can also look for drug assistance programs, and there are some online widgets. The Plan Finder feature at Medicare.gov allows you to plug in information, and it will tell you what the best plan is for you to pick. So there are some things you can do, but once again, these regs are driving consumers to become, they must be more savvy. You cannot simply rely on your doctor, your government, or your insurer to tell you what's good for you.
Well, Nick, open enrollment continues through December 7th. Any tips for seniors?
Yep. The mistake I think that a lot of seniors make is they will just keep the plan that they have. But the law allows for plans to change year to year. So
and this applies to everyone, not just seniors.
It does apply to everyone, every open health care plan. So what you want to do is you want to look and make sure that the plan you have today is still going to be good tomorrow. You might find that changes in your plan over the last year, some of the drugs that you take may not be on that plan. They may not be favored. You may pay more. Doctors who have been on your plan may no longer be on your plan. I think a lot of seniors and individuals, Americans, are really intimidated by this process. It's not that complicated. Make the effort to go to Medicare.gov and see what your options are. If you need some help, consult a private insurance agent, a broker who will not charge you, but can give you advice. And then if you contract with a particular insurer, that's how they collect their commission. Always good to seek advice from somebody who knows the business. But the bottom line is look at what your options are before you make a choice.
Read the fine print and get help. Don't be afraid to ask for help. Very important information. Nick Tate, thanks so much for being with us.
Good to be with you guys.
All right, and make sure you also, we want you to weigh in too on this discussion. You can take the National Medicare Survey, tell Congress what you think about these recent changes to Medicare, and also you see Nick's book up here. Never too late to get that as well. The Obamacare Survival Guide, available now everywhere. We'll be back with more right after this.